So I'm very briefly just going to set the scene for 5 minutes or so, talking about the importance of survivorship in neuro-oncology. Brain tumours represent a fair chunk, 27% of all childhood cancer diagnosis. And advances in surgery, radiotherapy and chemotherapy mean that we now realistically expect to cure a very large number of these. So 5-year survival figures are now over 80% for many tumour types. The difficulty is, as more children are surviving after a brain cancer diagnosis, the impact of the treatments that we're using is starting to grow in importance. And I think there's been a paradigm shift in the last 20 years away from cure at any cost to the quality of the cure, thinking about what we hope to achieve. Late effects probably affect at least 60% of children, young people who are treated for a brain tumour. There's all sorts of different degrees of that. The worst possible scenario, obviously, is dying of some late consequence of the tumour. Second, subsequent malignant tumours, chronic health conditions, and I'm thinking here of things like endocrine conditions and obvious neurodisability with weakness and so on. Slightly more hidden things like neurocognitive effects, mental health problems. Things that can be measured as adverse psychosocial outcomes, effects on life, like education, employment, and marriage in the future. Functional limitations and financial hardships. There's all sorts of things. It doesn't make for very happy reading to think through these things. One of the biggest challenges in this is who should be helping, who's supposed to be responsible for sorting all of this out. If you say, as we often do in hospital, go to your own doctor, your GP. Unfortunately, most primary care doctors would say they have no specific experience in caring for paediatric brain tumour survivors, and they feel as uncertain as many other people about what to do and who should be helping. The specialised centre will be involved early on, but you'll find that visits to the specialised centre and the contact starts to tail off at the very time that the late effects are becoming more and more of an issue. We all recognise that strong family support is crucial to help with good survivorship, but families face their own challenges, and we see this around the time of diagnosis and treatment for brain tumours. And there can be all sorts of things that then compound the issue with financial stresses and caregiver burnout over time. So how do we achieve success in survivorship? First of all, by recognising the scale of the problem. Helen's been central in that, with starting the Success Project 25 years ago, I think it was, to look at the scale of endocrine after effects of tumours. Minimising the impacts of the treatment. And treatments are changing. Gradually, we're recognising that we try and use radiotherapy more thoughtfully and try and avoid using it where that's possible. Chemotherapy regimes are changing as part of trials to try and minimise the impact of that. Surgically, we're in some cases de-escalating the scale of the surgery we do if we think that that will still lead to a good outcome, but reduce the possibility of late problems. So we're modifying what we do at the front end. Continued care for specific problems, and we'll focus on this and hear more about this later on, thinking particularly of endocrine problems, which has been one of the big focuses of Success. It's a bit American, but perhaps targeted interventions in recognised problem areas. We recognise that socialisation and emotional processing are things that can be very significantly affected, and those are things you can target, and if you're going to have neuropsychology input, those are things that you can kind of work with. And then recognising the need to provide holistic late effects services. I think about 8 or 9 years ago in Nottingham, we set up a late effects clinic. It's happened on a regular basis, which I attend. We have an endocrine specialist. We had a neuropsychologist at one point. We have a late effects specialist nurse. And that runs on a regular basis and provides a point of contact that is tailored to the needs of the individual patient. And continuing to fund and support and grow those kind of services is absolutely critical. I'm not going to say much more, but just refer you to one voice that I found when I looked on the internet a week ago on survivorship. A very eloquent piece from a young lady called Elizabeth in America, who describes her survivorship as feeling like a never-ending journey. Just when she thought things were going well, about 20 years after she'd been treated for a medulloblastoma, and she said she was trying to put it all behind her, she discovered she'd got a radiotherapy-induced meningioma. And we see exactly that sort of thing happening, unfortunately, for many people. It isn't just a journey, it can feel like a never-ending journey. So sorry if that sounds negative, but we're setting a scene for what we hope we'll hear some positive things and some solutions over the rest of the day. So welcome, and thank you very much for coming, and I hope we have a very productive day.